Hi, I'm Beena Patel, a physician associate turned spiritual mentor, quantum healer, women's coach, and speaker. Welcome to The Voice That Sees. This podcast is an intimate dialogue on topics ranging from science and spirituality to alternative forms of healing, vulnerable storytelling, the esoteric ancient wisdom, the power of individual transformation, and how it impacts the collective evolution of humanity. Each episode, you will learn how to evolve by shifting your mindset and ways of being, express your vulnerability to heal and transform, and channel your emotions into self-expression, creating a greater impact in the world. Let's continue your journey together. Welcome back to another episode of The Voice That Sees. Today, I have a very special guest, Karen Popkin, who I'm so honored to have with us today. She grew up in Toledo, Ohio, and moved to New York in 1992. As a child, she took piano lessons, sang in choir, and joined her school band. Currently, she plays euphonium in the Manhattan Wind Ensemble. She's a board-certified music therapist, which is a national credential, and a licensed creative arts therapist in New York State. And we've also had the pleasure of briefly working together in New York City, which I'm thankful for. And again, I'm really grateful to have you on the podcast today, Karen. So thank you for being here with us.
Beena, thank you so much. It's wonderful to be able to connect again after all this time.
I agree. I agree. Thank you. So, Karen, today I would love to start the conversation because I'm actually very passionate about the healing arts. And it's something I learned about in Colombia, which was where I first trained clinically. And I could see that so many cancer patients wanted to learn about music therapy, art therapy before just resorting to medication for anxiety or something. And I do want to set the disclaimer because I do talk about this a lot on the podcast. I'm not against medications. However, I believe that there's a holistic approach to a lot of things in life, not just healthcare, many different areas of our life. So I would love to learn, what was your journey to deciding you would become a music therapist? I know you have this big background in music, you clearly love it, but what inspired that love?
Right. Well, I did my undergraduate degree in music education, and and I knew that it was important to keep music at the forefront in my life in some way. But, I found myself becoming very interested in psychology, and I was really interested in becoming a therapist. So music therapy just made natural sense for me. And I was fortunate enough to get into a grad program at NYU.
Right.
And that was perfect for me because their focus was really on using music in psychotherapy. And so it really allowed me to delve into what happens in our psyche, how we connect with other people, how we connect to ourselves, to our own issues, to our need to express ourselves. And we can use musical experiences as sort of a microcosm to create this field of play where we can learn so much about ourselves and explore.
I love that. The piece that I would love to go a little bit deeper, it really stood out to me. You mentioned music and psychotherapy. Can you share a little bit about that? I'm curious because I think many people have experienced psychotherapy.
Yes, and there are so many different approaches to doing psychotherapy, and this is another one. So, coming from a humanistic perspective, valuing the uh, the personal expression of each individual that we can encounter, um, and finding out how to use music as a way to create a therapeutic bond, as a way to help a person build self care tools, and also a way to express emotions, feelings, revisit important moments in life, um, to tap into one's creativity I feel that when we're expressing ourselves, when we're putting our own expression, our own artwork into the world, it's incredibly life affirming. And so, you know, when we are making a connection, a therapist, client, therapist, patient, family member, whomever is, interacting, using music as a way to connect really helps people to feel at ease. Very often, it also helps people to delve into the realm of thoughts and feelings in a way that regular talking therapy might not.
I thank you for sharing that because I feel I can also attest to that sometimes in that therapy is very useful. I do find even talk therapy, I think it depends on what people are going through. Some people might just need that space to just blurt everything out. However, there's also a piece with somatic healing and understanding that there's so much emotions live in the body, sensations that we have and we experience. They're telling us something. And I've been reading papers on this because I presented something on healing arts in terms of alternative healing under the umbrella of alternative healing for thyroid cancer patients last year. And one of the things that really stood out to me is one paper, it was done in Canada. I think it was a study that was done in Canada, and they were alluding to how cancer patients sometimes with art therapy, they can't really completely conceptualize it. They still felt a shift in their mental and emotional state. So I love that you share that because there are some things it's like what you said, some things we don't really need to understand fully to grasp that it can still be beneficial for us. We notice that we feel something and that could be enough for us in the moment. And I feel that maybe sometimes people feel that in concerts too. Concerts, there's such a vibe. There's live music. There's so many people whose hearts are open, ready to receive the medicine of the healing instrument, the
Mm.
words, the sounds, the tone, the symphony. And once you start feeling that, because I used to be really shy, and sometimes when I would go to concerts, I'm like, how do people just dance and unravel fully? You'll see people just constantly, just get sinking into the moment. I'm like, how do they do that? But if you can allow yourself to just be there, as you mentioned, without thinking too much into it, you start to feel a certain way. And it's like you're riding the wave. You're riding the wave of the music. And you're no longer thinking, oh, what's someone thinking of me? Or, am I being too much? You're just allowing yourself to express, which can be so healing. So I
Absolutely. Yeah.
thank you for sharing that. So is there any personal transformation you would like to share that you feel has helped you on this journey? Because I know a lot of times for artists, even clinicians, many clinicians are artists. I find many doctors love to explore art. Many different people have something I wanna say on the side, but it's something that they deeply love, dancing, poetry. I love poetry. It's these different healing modalities where they're able to make sense of the world that they're exploring, because I can say from personal experience that working in healthcare, especially in oncology, as you have worked with so many oncology patients, you feel deeply connected to the work that you do. Also, it can be it can feel like an emotional weight sometimes. Sometimes you might ask yourself, "Why is this patient going through this? How are they able to handle such a burden?" It brings up all our stuff too. So I'm curious, is there any personal transformation you feel comfortable sharing today?
Oh my goodness. Well, I feel that as a music therapist, uh, I have worked with so many individuals, patients who are actually teaching me some important life lessons. And I can think back, I've met hundreds, maybe at this point, even thousands of people. But, I can crystallize in my mind, certain memories of someone who sits with me. We're exploring musical instruments together, rhythms, and they'll maintain a sense of wonder. Even as they may be late in life, perhaps um, dealing with a troubling diagnosis and trajectory of illness, but still maintaining a sense of wonder, of being able to live in the present moment and to be able to enjoy what is right in front of them in that moment. Um, it's incredible. It's an honor to be let into someone's life in those moments. And some of the folks that I've worked with, whether they're sharing with me why a particular song means so much to them in their life, or they're giving me a totally new perspective on a piece of music, let's say, or or we're playing together or creating a song together. um, their philosophy for living is coming through in those moments. And how can you not be affected by that? I just feel like the humanity of that, uh, the honesty and the connection that can happen is so profound. I think that it helps me to continue to feel very grateful each day for the profession that I'm honored to be able to do, but also for my own life or what I have and the people that I've been fortunate enough to meet along the way.
I feel as you were sharing all that, I was just thinking about how I have had some moments in different institutions, but the one that really stands out for me personally is my first role, maybe because it was my first entryway, my first big girl job, so to speak, in New York City. And I'm remembering that I was going through a life transition at that time, post breakup and then starting my first big girl job. And it was a long term relationship. So, navigating all the different emotions, but also being in my 20s, I had a lot of pride. I will share. It's something I still work through. It's part of the human journey. But at that time, there was a lot of it. Instead of saying, yeah, I'm feeling hurt from all this stuff that transpired, instead of admitting to the heartbreak, I kind of kept a wall. And what I noticed in that first role of mine as a PA in bone marrow transplant, I noticed that most days that I would come back from the hospital back to New Jersey, I would cry. I would cry so much on the subway from different encounters I have with patients, seeing their strength, seeing their perseverance, also witnessing their vulnerability. Some of these patients, the conversations we've had, we would have with the families. I feel that if anyone's working in oncology, there's something really special that gets transformed in our hearts just by the very nature of having the privilege of working with these people, just as you mentioned. And I'm being reminded of that as you said what you said, because some of those tears I could not hold back. And in a place like New York City where you kind of want to keep to yourself on the subway. You don't really want to attract attention. But when the tears come, you can't hold back sometimes. It's like you finally have space to grieve and to process everything that transpired in the shift. And I can only imagine what you also come across as a music therapist, because then I'm sure people are sharing even more of their vulnerable, intimate aspects. Not that they can't do that with a clinician, but sometimes it's the standard, any nausea, any vomiting. Meanwhile, a healing therapist comes in and suddenly they feel like they have space to just breathe and talk about the other things that can actually be ruminating in their mind longer than some of the physical symptoms. Not that one is more important than the other, but more so that they probably don't have that outlet until
Yes.
someone like you walks into the room. So I can only imagine, and I do want to just share what an honor it is to have people like you in the field, because sometimes I've seen it also as a patient. I can share that there are many incredible clinicians doing this beautiful work on this planet, and I definitely want to attest to that. Also, sometimes whether people have been burnt out or they sometimes forget that, it's not just our lives that we're experiencing, it's also walking people through their own journey and seeing, as you mentioned, what a privilege it is to be let in because they don't have to, right? I've had some patients who, when I walk in, it's just like, mm-hmm, nope, yes, it's hard to kind of crack through. And immediately I'll be like, "No, I don't wanna deal with this patient." The pride and everything comes through. But I've had moments where I walk out and I'll have a conversation with someone and they'll be like, I bet there's something on the other side of this. I bet you guys will actually connect deeper. You just have to go in and be compassionate and try again." So I honor this part of the conversation that came up because it's so easy to forget that. And I feel that oncology kind of strips you of that pride. Not all at once, but day after day, you kind of open your heart a little bit more to people's pain and suffering. And in meeting that, you're able to meet your own and also see that sometimes when people are blindly throwing their stuff, they're experiencing something, yes, but also they're forgetting that, it's not just us, we're part of a greater whole, and there's so many people moving through things. So,
Absolutely.
yeah.
Absolutely. Yeah, I've definitely encountered people who at first are not quite sure about music therapy. Like, why are you here? I'm here to get medicine. I'm not here for that, you know. Or I don't know why my doctor referred me. You know, or they think that they have to be in a good mood in order to have a session.
Mm.
Yeah. "Oh, this today's not a good day because blah, blah, blah," you know? Um, and so working through and trying to continue to show up and be present, for people who are not necessarily ready to let you in the first time around is so important.
Yeah.
And sometimes, once you do get that permission to just spend a few minutes, maybe just try let's have one song together or something like that. That can just open the lock. Sometimes the very first strum of the guitar, uh, I'll see the tears begin to flow and the release begins to happen.
I feel like I was laughing nervously because I feel like when you said that they think that they need to feel better in order to join a session. I feel many people can relate to that. So can you address that a little bit deeper? Because I feel that sometimes it's hard, especially if anyone is moving through, like anyone who's listening to this, anyone who's moving through a transition in their life, or just any day where they feel heavy with the doubts, heavy with anxiety, or even depression. These things can weigh on people physically and they might not be able to get out of bed. And it's so interesting because anyone who dances know that's exactly the moment when you need to dance. You can be with your feelings, but you also need to move the energy and remember that there's life moving within us, the vital life force energy. But it's hard. It's hard to do that when you're deep in that. So how do you navigate that? I know you mentioned, just letting them know it's just one song, but how do you do that maybe in your everyday life? Just encountering maybe a friend or a loved one who also needs to be reminded. There's still
Right.
a beautiful symphony unfolding in your life. This is just one part of it. It's an ebb and flow, right? So how do you navigate that?
Yeah, it can be very tricky when somebody that we're with is stuck. And we all know, I think most of us probably know what it feels like to be stuck ourselves. Um, how do we enter into their space and be with them in that feeling of not being able to move and begin to open it up just a little bit? Um, it can be very challenging in a personal element. It's sometimes it's harder as just a regular person as opposed to in my role as a therapist, where I feel like it's a little more clear. But for me, to move forward. But yeah, I think just finding what is something that's very small right now that we can do. And if I'm with somebody who's suffering, who's stuck, I usually check myself in that moment. What am I feeling? Because I may feel some tension in my own body, for example. Um, if I'm feeling some of the heaviness, some of the sadness, I'll just take a moment to notice where is it registering in my body, and And one very simple technique that we can all carry in our pocket is to breathe into that space and maybe to do a little bit of vocal toning, just a little humming, finding the the frequency, the tones that resonate in that space that you're feeling in your body, where the heaviness or the tension might be sitting. And I feel like when we can um, model for the person that we are with a way out, a way to start to move, then that is offering them something without forcing anything, just being there with them in that moment and offering a shift can be something. We're giving an option in that moment.
Yeah. It's those are very wise words. When you mention breathing into the sensation, I think that's a really beneficial tip for a lot of people and potentially also clinicians. Because sometimes clinicians, we're still people too. And I definitely had moments where I've taken things personally. A patient might have not looked at me in the eyes or mentioned something that they mentioned to another provider. And then it's like, well, you made me look bad on rounds. I wasn't able to speak to this. It's like, kind of taking it in such a personal way when it's all that discomfort. And I've seen this not just within me. This has been it's if you ever go to a clinician room and notice different providers talking, these are usually things they talk about. What did that patient mention with you? What did they not share with us? All these different things. Obviously done in a confidential way. Sometimes what I'm learning, especially as you're sharing this, is that when we are present with ourselves and the sensation that's coming up more than the stories, because the stories can go all day, right? But we have, in order to pause, it's not by trying to stop the thoughts, because then it's like the resistance pushes it even more. If we can feel into our sensation, just notice, okay, I feel a little tense here in my chest because the patient is not registering or not responding the way that I would expect them to. And noticing that we can soften. And usually, what I gather from what you said is that that moment of showing self compassion for ourselves, whatever we're experiencing, usually melts that away for us and helps the other person also feel more welcome. But it's not always easy to see in the moment. So I really thank you for sharing that because it's something I think we could all use as a tool.
Absolutely. And, sometimes when someone is pushing you away, they can be abrasive about it. And it's not easy to keep your footing in
Yeah.
those moments.
Yeah.
Uh, but that's why reflection is so important because we can learn from those moments as well.
Absolutely. Absolutely. These are very wise words I wish I had years ago. So I have to ask because I don't think I've ever walked into a music therapy session with you. I know I've spoken with you outside of encounters. What does that look like? Can you walk us through what that introduction looks like? And also, how do you choose the instrument that you work with the patient?
So each session is going to be very different because it's personal. It starts with being open and being ready to assess what is in the environment and how the person that I'm visiting is presenting and how they react when I come in and introduce myself. So, one of the ways that I would sometimes begin would be a process of discovery. If I'm talking with somebody who's a little bit open, um, I may just bring my cart of instruments to the bedside and offer to show them the different things that I have. Um, Take out different drums, shakers. Maybe I've got my guitar with me. I may have a one of those hand pans. Something. I like to have a variety of different textures of sound. Um, and as I go through and um, do this tour of the instruments, along the way, I make it clear that everything that I'm taking out, you're welcome to play. You're welcome to hold it, feel it, and experience using it in whatever way feels good to you right now. So that can be a really nice introduction, and can sometimes then lead to being able to do an improvisation together. There are other times though where somebody just jumps right into the songs that they like. And so we may be singing together, or they just may want to listen. There are a lot of other examples though where I've gone in and somebody is feeling like their energy levels very low. They're not feeling comfortable to use their hands in that moment or to sing, but rather they're more focused on being able to get themselves into a calm state. So in those instances, I'll often offer a music-based breathing um, or a music meditation practice.
Okay. I would like to know more about the music meditation practice. I think that's really
Sure.
interesting.
Yeah. So often I'll use guitar for that, but I might use something else. But most typically I would use guitar. I would ask the person to just get themselves into the most comfortable position that they can, so that they can pay attention to their body, pay attention to their breath, without giving them specific instructions for breathing. Um, just to begin to be aware, to take notice. And I'll often, begin with just playing the guitar to settle in and create a sense of rhythm, a sense of pacing that they can use as they're settling into the breath. Thinking about, how we can use rhythm to align with our own heartbeat, with our own breathing in, breathing out. And then, as I continue to play, I would give some cues for paying attention to the breath.
Okay. So it sounds like there's synchronization.
Exactly.
Okay, that's really beautiful. I'm just curious because sometimes I would have done meditations with patients, but I wasn't a music therapist, so I would bring in Insight Timer or an app and play ocean sounds or something in the background and then have the patient breathe. But that's really
Wonderful.
interesting because I've always learned so much from you and so many of the different practitioners in integrative medicine because things like this seem so simple that we disregard it as other clinicians in other departments, and yet patients do want this. They just can't put the name on it. They don't know that they're looking to feel that sense of relaxation by being able to synchronize, as you said, the heartbeat with the sounds and then feeling that sense of relaxation and calmness that feels so simple. And I think anyone who's undergone a cancer diagnosis, they're looking for the simple. So hearing you say that is just such a reminder of that.
Mm.
Okay. So I guess the next piece I would like to ask is there any personal transformation you have experienced in your own life that's made you feel more deeply connected to patients as you offer music therapy?
Oh my goodness. Of course.
And I know it's
um,
easy. I know it's not easy because I'll
yeah.
share even as I'm writing. So I've been writing a lot. I'm a poet and also I have been working on a book for more than 2, 3 years now, and I'm noticing the edge that I've been meeting as I share more intimate stories because it's about my life. But with the same token, I'm noticing that if I don't share those pieces, I'm also holding myself back from connecting more deeply with whoever reads that book. So I get it. It's an edge because I can't just say, okay, well, knowing that, I just got to rip it all open. It's not like that, right? It's a journey of meeting that. I just welcome you if you do feel comfortable sharing anything, however deep you want to share, because I feel that someone might be listening to this. Who knows? They could be in a hospital bed. They could be in a place in their life where they're moving through a transition and it could be moving for them. Just noticing, the different ways that we have gone through our own journey too, because we're also people, we're also humans, care providers of care. service providers, therapists, music therapists, doctors, PAs, NPs, we've all gone through some part of our journey. That's why we chose our profession, right? So I feel that this could be something that touches someone.
Yeah, I think, it's so far back in my rear view mirror, sometimes I don't really, revisit these thoughts, but, my tumultuous 20s, um yeah, yeah, I feel like, when we're in our early mid-20s, for most people, it's a
Most, yeah.
very large growth period and sometimes a painful one for so many people becoming a real adult and figuring out how we're going to fit into the larger world. Um, just going through, you know, bad breakups, um, and figuring out, a career path, um, that process of, I guess, peeling away the layers of the onion, that we find, where is our center, where's our core, right? So, yeah, I suppose thinking back before I went to grad school, um, I was working, I wasn't even doing what I had studied in school. So I graduated with my degree in music education, but I was living I in Boston at that time. Um, there was, as I'd heard, a big sort of hiring freeze in the school system. So I was managing a dental practice and doing a little bit of music education type work on the side, um, and experiencing a terrible breakup, that kind of crushed my whole idea of what my I thought my future would look like. Um, and sort of coming out on the other side of that, realizing that I could be stronger than I thought.
I love
Uh, yeah, yeah. So, a lot of tears, a lot of where am I? What am I doing? What, how do I make sense of this? Um, and I suppose that during that time is probably when I started hanging out at a bookstore, and finding myself really feeling like I just want to, um, learn more about the field of psychology, and then through that, realizing, "Oh, right, music therapy, duh. Why don't why don't I explore that?" So, even in my work, in the dental practice, I encountered so many people who were coming in who were nervous, who were in pain, who were, trying to manage, um, a busy, demanding job and a demanding lifestyle. And, some of the people really talked to me, um, while I was sitting at the front desk in that office. And I felt this connection to, this pull to wanting to, be able to help people in a deeper way. And so I feel like everything probably happens, we can find a reason, right? There may not necessarily be a predestined reason for what happens, but we can make use of it.
right, to find meaning in different
Exactly.
circumstances, yeah. I love that you shared that because you mentioned and I feel like I shared a somewhat similar story, but tumultuous 20s, maybe not everyone had that, but for those of us who did experience to that degree, looking back, some of those moments, they're almost a catalyst for some of the deepest transformation. We really discover these hidden aspects within ourselves that then, when we have healed within and transformed, we want to share that with other people. It kind of ignites our purpose in a more meaningful way, right? So I think that is very important information that you share that. I thank you for sharing your vulnerability because I know it's not always easy. And sometimes we shut out those parts because, we move past, we move beyond. But sometimes it's nice to just remember what got us here as a reminder that sometimes when we might encounter someone in their 20s now and they're just like, in their own head and just, ugh, it's like, okay, I get it. I've been there before. I needed to make a name for myself. I needed to know which career I was going into. What's my life going to look like in terms of love and partnership and all these things? And I feel that this is also a story that many women have gone through, if you want to call it the heroine's journey. And so sometimes when we're meeting women and men of different ages, we can kind of remember, well, where was I when I was that person's age, right? We can still have had different backgrounds and different experiences in life, and sometimes we can also remember that common thread that binds us all, humanity. And remember that we do go through certain things that are similar and that might be resonating with us. As in many people after 21 going out into the real world, they're trying to figure out their lives and their path and their purpose. Many people have gone through that period. And so when we remember that, it's like, oh, now I understand why this person is behaving like that, or just having more compassion for people on their journeys. And we can't really do that until we meet those vulnerable aspects within. And again, it's not easy. I feel that for me, what I've been through in my 20s has kind of, I won't say force, but because I know that there's some gold on the other side of some of those moments, I'm more willing to say, okay, I'm willing to meet this part of me. It's not always easy though, even though I will share that. And yet I feel that when we have these tools, music, art, just like you said, being able to understand that we don't exactly have to be able to put logical thought to it in the moment. We can just feel it, to process it, be with it, express ourselves in whatever ways we want to express ourselves. That alone can be the medicine.
Well
So
said.
I
Yes.
think thank you. I think that can be really testament to the work that you do because in passing, in between the chemotherapy, in between the different medications, the different things the patient is receiving, in between all that, patients might have the safe space to just be like, no, they're not getting up to get something. It's like they can just let go. And being able to let go, that can prepare them also for the rest of their journey.
Mhm.
So it's such an instrumental part because it's something that I usually refer to as the void, the part of the in between for many people when they're going through transitory moments in their life. It doesn't just have to be diagnosis. And usually it's in that transitory space where all the emotions come up. It might not be easy for someone to hold. And yet, when someone like a healing therapist, a healing art therapist, a music therapist walks into the room, you're able to hold that space without the person, the patient, feeling that they need to perform, that they need to show up in a certain way, right? So that's tremendously powerful and impactful, the work that you do.
Thank you.
You're welcome.
Yeah, yeah, no, you stated that all so beautifully.
Thank you. Yeah, I feel, I lately, I don't know what's happening, but lately, you know my story. I moved to Costa Rica, learning about holistic healing and all these things. And I also go back to the States too, and something that's been uncovering my heart is I actually really missed the clinical settings recently. And so hearing you talk and also witnessing I've encountered different people talk about their own stories with their health journey. I felt this pull recently. And so, I would never say never, right? Like you never know where life will take you. Sometimes you'll be taken to the jungle to only discover that there's these unmet parts that may still want to deepen and grow in different ways. Who knows? But recently, functional medicine and integrative medicine has been on my radar. So I'm thinking about getting trained in that to be able to share that perhaps in a different way. It doesn't have to be in the hospitals. It could be telehealth. It could be so many different things. But hearing you share your stories and hearing some of these other stories too, there's been an opening in my heart. So again, we're all interconnected, like who knew that having this conversation with you would have reminded me, these are the amazing people I got to meet in clinical settings, not just my patients, yes, also the providers I got to work with, the different teams that I collaborated with. So it's been such an honor. It's been really such an honor. I just want to share that.
Well, thank you, thank you. And, for it goes in every direction, because it has been over the almost 20 years that I've been at the same hospital. Um, I've had the honor of getting to meet so many other amazing clinicians, so many really compassionate, talented, bright, caring people. And, you, of course, are amongst them.
Yeah.
Um, and I feel like it's been and continues to be a learning experience every day.
Yeah. I do miss that. Oh, sure. Thank you for sharing that. I do. Yeah, that's nice. It's really nice the way that you share that. Okay. So, in wrapping it up, and thank you for all your beautiful wisdom and all that you shared today. I would love to know. So, you're sharing all this wisdom, you're meeting so many different people every single day. Can you share one gentle way as a music therapist that you might unwind every day to make sure that you come back into that state of vitality and that you're able to continue to do this work every day? What's a self care practice that you can share with the listeners?
Well, I feel like it's, self-care is something that we practice hopefully every day throughout the day in a variety of ways. So, this is something that I always talk about when we're working with trainees, with our music therapy interns, for example. Um, I'm a big believer that throughout the workday, you should remember to drink water. You should make sure you eat your lunch, take a break. Um, there are times when we are very impacted by uh, sadness, by heartbreak that we encounter with the people that we're working with, and so it may be important either at the end of the day or sometimes in the middle of the day to just go find a corner for yourself and acknowledge what you're feeling. I've had the experience before where I was working with a patient I felt very, very close to. After she passed away, I needed to just go to a spot where I could sit and play one of her favorite songs. I just got out my guitar and I just went through it, kind of sending it out, I guess, for for her and honoring her spirit and honoring the connection that I felt for her. Or writing a note to the family. These are all the sorts of things that we can do. And then after, after the workday, whether you're coming home, I sometimes will seek out something that will make me laugh, or or maybe I'll listen to some music that uh, takes me to a place where I need to go for a little while. Um, yeah, I feel like there are just so many different ways, making sure to get outside on a beautiful day and take a walk around the block, or whatever it is that helps us to care for ourselves so that we can continue to do this work.
Absolutely. Thank you for sharing that. Also, the piece that I really appreciate you sharing is feeling, that sense that we're all interconnected. Even after a patient's passing, I felt it. I've had to declare patients. You still feel something. Yes, you're grieving. You're also being there with the patients, but it's still, especially when it's so fresh. I felt like there's still something in the room. This person, the spirit is still transitioning. I felt that. It's a very surreal feeling. I wouldn't even know how to put into words. I wanna say it kinda feels heavy, but it doesn't feel like heavy, like something weighing you down. It feels like there's something transitioning here. It's
Right.
doing its own process. Again, it's not tangible. I can't put words around it, but I can feel it. And
Yeah.
it does
Yeah.
impact
Something
us.
that it commands respect.
Absolutely. It definitely and humbles you. And just hearing you share it, it's like we do have to take moments as providers to honor that. We can't just go into another room and just pretend nothing happened. We have to respect that, be with it, and hold the space for it, and also hold the space for ourselves that also feels deeply connected to it and is experiencing that sense of grief in that moment. So thank you for sharing something really valuable, really important, I think, for many providers and even anyone who just might be experiencing grief or going through, again, transitions, because transitions, I feel, bring up those moments where it's kind of like it's the loss of an old life to welcome in the new, but it doesn't mean the old life doesn't matter. It just means that you're gently parting ways in whatever way feels resonant for you.
Thank you.
So, Karen, just to wrap up this beautiful conversation, I would love to hear what your key takeaway for anyone listening to this would be, whether it's about music, about life. What's the message that comes up in your heart that you'd want to share with people right now?
Well, in my work, I often encounter people who forget to use music. They are in the midst of coping with a very serious issue, and they forget that they have these internal resources and they have a love for other things. And so it's understandable that, someone's total focus becomes managing their treatment regimen, managing their family schedule, etc. Um, and so just reminding people that there's that's very simple, very accessible that they can use seems to be for so many folks that I've encountered seems to be that like a little bit of an aha, a little bit of a light bulb coming on like, oh yeah, I forgot how I forgot how much I get out of just making a little time um, to put on some music that brings the kind of energy that I need in this moment.
Yeah. Thank you. I feel like this is something that a lot of people will walk away with thinking, yeah, I just need to go back to the simple things, you know? It's often the things that we miss, but they can be sometimes the most transformative because then it gets you into the domino effect of doing the other things too.
Right.
Thank you. Thank you for sharing that, Karen. So, where can listeners find you and your work if they wanted to reach out or if they just want to learn and explore what you offer?
Oh, great. So we do have a, a page on the mskcc.org website where you can search music therapy and you can also see more information about our integrative medicine and wellness service as well. And so you can see a little bit of a blurb about the therapists on our team and some links to additional resources.
Okay, beautiful. And then what I'll do is I'll actually gather the links from you and then I'll put it in the show notes so anyone who's listening can also find it right in the caption or the description. Karen, this has been such an honor. I feel that I learned a lot. I was absorbing and I was like, whoa, there's so many things that are just unraveling as you're speaking. So thank you again for your time today, for your wisdom. And for anyone who's listening to this, I hope that you gain some pearls of wisdom as you listen to this conversation. And just to remember that wherever you are on your journey is perfect for you and that there are these beautiful tools and healing modalities available for you on your journey. And again, it's sometimes just about, as Karen mentioned, just coming back to the simplicity of life and remembering that some of the most simple tools can sometimes be what's tremendously healing. It might not always be all of it, although it can be all of it for some people, but for some of us, it just might be the thing that we need to push to do some other things. And so there's a lot of benefit with music therapy and understanding how it can help with things like anxiety, fatigue. This is evidence based medicine, the way complementary therapies can help in cancer treatment that I'd like to point out. And also, just in general, on our human journey, it can be so beneficial to be able to be with our emotions and to what I feel you brought up so much today, Karen, is about honoring our humanity and respecting the human evolution, which is such a journey. So thank you. And I'll catch you on the next episode of The Voice That Sees.
Thank you so much. It's been fantastic to spend this time with you.
Thank you for listening to this episode of The Voice That Sees. Please be sure to check out more episodes every other Tuesday on Apple, Spotify, iHeart, or wherever you listen to your podcasts. For additional content, you can follow me on Instagram at The Yoga Movement. and YouTube at the Yoga Movement NYC. You can also check out my coaching programs and unique offers on my website at theyogamovementnyc.com to help support your individual and personal transformation. Until next time, be you and be well.